Hi. All right. Hi, everybody. I know I was just introduced, but I'm just going to give a little bit more background. I've been doing metabolic nutrition for, I don't know, at this point, over 30 years, I guess. And we had a large MSUD group in when I worked in University of Wisconsin in Madison. And so a lot of my experience I did get from working in Wisconsin, which had a relatively large Mennonite group, plus many others in a wide spectrum of MSUD. Our population in Oregon is much smaller. We do have some MSUD patients, but I will say a lot of my experience was with the patients that we followed in Wisconsin. So I'd kind of just like to get an idea of okay. I'd like to get kind of an idea of the person that you know who has MSUD. Are they on diet? Diet, okay. Is anybody here affiliated with somebody who's been transplanted? So most of the people here are patients who are on diet. Okay, great, that helps. Anybody with the person that you know under the age of 3 years, or are they all a little bit older? 2 years? Okay. All right, great. So I'd like to talk about nutrition and medical management of MSUD. Just some basics. And this was talked about this morning, that the incidence in the general population is about 1 in 185,000 births. So very low, makes it an ultra rare disease. But in the old order Mennonite group, it's much more common. They have a common genetic mutation, common genetic variant, and it's about 1 in 400 births. So big difference. Just some classifications, and again, the person that either your child or yourself probably know which classification you are in. The classical presentation tends to have less than 3% enzyme remaining. And so they tend to present quite early on, typically 3 to 5 days of age, I would say. And they require, for diet management, a diet that's quite low in leucine. They have a low leucine tolerance. There is a more, what they call intermediate MSUD, which if they aren't, with screening, they're picked up early. But if we didn't have screening, their presentation, they would present a little bit older. They would, might be weeks to even maybe a couple months in this category. So they tend to be less severe than classical, but again, do require diet treatment, and again, unless they're transplanted. There is a group called intermittent MSUD, and this group, when they're healthy, have normal leucine levels. When they're sick, that's when their leucine levels increase. This is not very common, but they are out there. Again, tend to not require diet, or very, they're pretty liberal in what they're able to eat, except when they're sick. And then there's also a group which is pretty infrequent, but there are a group that's what they call thiamine responsive. So thiamine, the B vitamin, that's a cofactor for the enzyme that's missing or low in MSUD. And by giving high doses of thiamine, those people tend to do just fine. Again, not many people in this group, but they are out there. I'd also kind of like to keep it pretty informal, so I'll stop after a while, get some questions. But so the classical presentation, often around 48 hours of age. They might not feed very well anymore. They have a weaker suck. They might start losing weight. After that, they can become lethargic, which means kind of floppy, or also that fluctuating tone where they have that arching back. That I believe it was shown this morning. If we're not starting treatment there, then we can really run into problems where they can develop seizures, metabolic acidosis, cerebral edema, that's that water on the brain, which is really what is very serious in untreated MSUD, and which is also what often causes their demise or their death. Some of these more milder forms, they still can decompensate with illness. Sometimes they have more developmental delay, more psychiatric problems are described in the milder forms, and sometimes the classical presentation, probably more likely because these tend to be picked up later, at a later age, and newborn screening has really helped with picking this group up sooner than later. Okay, so again, we have newborn screening now. All states do it. Many other countries do it as well. But you need to confirm that diagnosis, and that's where plasma amino acids come in. And what they're looking for are elevations in those 3 branched chain amino acids. Leucine would be the highest one. Then typically valine is the next highest, and isoleucine. The thing they're really looking for is something called allo-isoleucine, which is a compound that's made only in MSUD. So only patients with MSUD will have allo-isoleucine in their blood. Other individuals without MSUD don't produce it. So that's really what they're looking for when they want to confirm that diagnosis. Okay, so just some general diet principles, and I will go through and talk about each of these basically, but just in general, what are we trying to do when we put somebody with MSUD on diet? We're trying to maintain near normal plasma leucine concentrations, and we'll talk about what levels we're shooting for. Total protein, so that's formula plus the protein that you get from the diet. People with MSUD have a higher protein need, a higher total protein need. Most of that will come from formula, especially with the classical group, but we do tend to have higher protein intake in the MSUD group compared to what's recommended for the general population. Energy needs tend to be normal. So we use the same numbers for energy that we do for just the general population at different ages. That doesn't apply when they're sick, but when they're not sick, they tend to have normal energy needs. We want to prevent isoleucine and valine deficiency. We'll talk about that. For the food they're eating, we're going to count milligrams of leucine. Talk about that. Frequent monitoring. And again, this is when they're not sick. Amino acids for infants are typically done once or twice a week. And about once a month for adults. It would be great if we could get it more often, but But that's typically what we're able to do is once a month. Again, it's been shown the more monitoring you can do, the better control seems to be. So certainly keeping people monitoring their amino acid levels, even when they're adults and they say, I'm fine, I feel fine, don't bother me, we still like to check their leucine levels. We'll talk about ketones and how to use them during illness, and then we'll also talk about illness management. Okay, so this is a principle that we all use when we're trying to balance all these amino acid levels. We're trying to balance leucine, isoleucine, and valine. We need to have all of these amino acids present for us to produce protein, in muscles, organ development, protein turnover in our bodies, etc. We need to produce protein. And if we have a deficiency in valine or isoleucine, meaning levels that are too low, this leucine level is not going to decrease.
Actually, take a couple of grape juice and go valine, all better or almond.
Okay.
The grape juice and valine and then all better for an hour or two.
Okay. Can somebody translate? I'm sorry.
I think she's trying to say when your valine goes down, everything goes down.
Yeah, but the valine and grape juice and your low work that way.
Yeah.
So when you... Okay. So what you're saying is if you're giving valine and isoleucine, that helps your leucine level go down. That's true. All these other amino acids, most of it's going to come from formula. And if we're not taking enough formula, we're not providing enough of the other amino acids, then again, we're going to have problems getting that leucine level to decrease. So we want that balance in the blood. And this applies when people are healthy, and it applies during illness. And so this is something that we just try and keep in mind when we're looking at levels. Are we providing enough of those other amino acids from formula, enough valine and isoleucine, so that the leucine level will decrease while we're producing protein in the body? Does that make sense? Okay. Okay, so let's talk about diet. I really kind of like this. This is something that was put together by one of the clinics of kind of a low protein plate. So you guys have probably seen the plate out there for the general population. And this one is just kind of a revision of that for somebody who has an inborn error metabolism where we're needing to restrict protein. And so we have the formula up here instead of regular dairy products. The thing I want to point out is about half that plate is fruits and veggies. And that's a good goal for all of us, but it's a good goal for those with MSUD as well. They're low in leucine, lower in calories than some of the low protein products that are out there. So it's kind of a good, kind of keep it in mind when you're eating, do I have enough fruits and veggies? Because that really can help with especially long-term, not only leucine control, but also preventing excessive weight gain. Okay, about the medical formula choices. So the ones that are designed for infants, there's 3 of them in the US, there's others out there and from other countries, but they're modeled after regular infant formulas. So they have the same energy, the same calories as formulas that are designed for the general population. They have the same vitamins and minerals. The difference is the protein source. So instead of intact protein, the MSUD formulas are going to have amino acids. They're not going to contain leucine, valine, and isoleucine. And these are, again, the three choices that we have. Where things get a little bit more complicated is when patients get a little bit older, and we're trying to decide which formula to use. So for those of you who have either kids that are older or are older yourself, there's lots of them out there now. When you're meeting with your dietitian at your clinic, again, we are shooting for high protein. Yeah, like that one.
I'm noticing these. I'm just going to demonstrate one of these.
Okay. I'm going to keep talking while you're walking up here. Okay, so.
Like one of these, the cool ones.
Yep. So again, we're giving more protein than we would for the general population. Best utilization, we want to divide it into at least 2 servings. So again, this is for older individuals. Infants will take this all the time. But the more you spread the formula out, actually, the better utilized it is. You're also going to see lower leucine levels if you're spreading that formula out, just because those the different amino acids are utilized better the more you spread it out during the day. Especially for kids, adolescents, have your formula recipe looked at by your dietitian, because needs change, and you want to make sure that it's still an appropriate formula recipe for you.
So for the
Yeah.
kids, are we talking about like having this readily available throughout the day?
Uh-huh.
For people who have a water bottle, they have the formula, they can just take a little
Yep.
bit throughout the day.
Yep.
So we're not getting large spikes, but rather gradual kind of.
Yeah, the more, again, we usually encourage for kids a good 3 times a day. More is even better. But yes, having it like here, we'll go to this next slide. Actually, we're going to go right here. There's lots of formulas out there now that are in those juice, yeah, like yours right there. They're, you know, liquid. They've got a screw cap. You can keep them cold. These are easy, relatively easy to take where you're going. You can spread the formula, and you can spread them out during the day a whole lot easier. One thing I want to say about these, and these are just 3 of these that are listed up here, but they tend to be lower in calories. They don't put as much fat and carbohydrate in them. And so for people...
The solution, I put a Valine iso soda.
In soda?
Yeah, Valine iso soda, you took care of that, the problem.
Okay, that's a way to take it too. There's lots of ways to mix this stuff. But again, for kids that are, you know, you're getting a little bit concerned about how many calories they're taking, switching to one of these formulas, you're going to get more protein per calorie. And so for somebody who's really getting a lot of calories from the formula, trying some of these options might be a good idea. There is also one that it's called MSUD amino acid blend. It only has amino acids in it, so it doesn't have any fat, it doesn't have carbohydrate in it, it also doesn't have vitamins and minerals. But if you're concerned about calories, I like using this one. You can mix it in some of the other formulas. Some people take this by themselves. You just really need to make sure that they're getting vitamins and minerals with it. But it's one way of decreasing calories from formula, but still getting enough protein without the branched chain amino acids. Okay. Which formulas are available depends on the state. So it's different in different states, but again, there's lots of options, and discussing that with your dietitian is, I think, a good, or your provider, whoever that might be, is a good idea. Okay. Any questions so far?
With the skin rash.
Oh, yeah, this is the kid with the skin rash, yes.
Skin rash. I mean, towards more allergy, I haven't get so.
Is there valine and isoleucine in MSUD formula?
No.
Okay,
Mm-mm.
so it's free of all three.
It's always, for the MSUD formulas, it's always the 3 branch chain amino acids that are missing.
Okay.
So the show that I came up with, I think
So
it's so long. My husband-
why? So it was brought up this morning. This is a very similar picture of a little baby who is not getting enough valine and isoleucine. And they develop this really wicked rash. And why does that happen? So they get this rash. They also lose their hair. They can become anemic. Pore growth is also common with if you're not getting enough valine and isoleucine. Why is this? It's because
An allergy?
leucine, no, leucine requirements are, and leucine in food is about 2 times that of valine and isoleucine. So when you're meeting your leucine needs, you're actually not getting enough isoleucine and valine because it's just lower in food. So to prevent those low levels, that's why we need to add valine and isoleucine, especially with somebody who has classical MSUD. There's different ways to make the supplements. You can mix powder with water. Out there, there's a company that now has a liquid isoleucine and valine that's all mixed up already. But again, if you're meeting your leucine needs, you actually are not going to be getting enough valine and isoleucine, and that's why we need to supplement. And if we don't, especially younger kids, we end up like that. Did anybody else have another question? Yes?
So my daughter, she is like supplemented with valine and isoleucine, but like normally she still has not this rash, but like still skin is very, very like delicate, and like doctors like just say like, oh, it's eczema, and keep trying like topics and like creams and lotions, but like it never goes away. Is this related to still like deficiency on isoleucine?
I would just make sure that the isoleucine and valine levels are in the ranges that we're shooting for. They are. Then it's really unlikely that it's valine and isoleucine. I know we have a physician here, or yeah, correct, PA, okay, who, there's lots of things that cause rashes for kids.
I'm sorry.
There's lots of things, that can cause rashes for kids. If their levels of isoleucine and valine are normal, it's really unlikely.
Normal, but like within the ranges.
Yep.
Okay.
Yeah. Then it's really unlikely that it's I guess I can't say 100% sure, but probably not. Yes.
You mentioned the isoleucine. That one is just to diagnose the disease, or is something we need to monitor as well?
We're going to talk a little bit more about monitoring, but we need to monitor leucine, isoleucine, and valine. Those all 3 need to be monitored.
The other one, the allo-isoleucine?
No, the allo-isoleucine, it doesn't influence what you do with diet. It's more for diagnostic purposes that you're seeing it. if you measure it, if they do an amino acid panel, they're going to see it and they're going to say, oh, he or she still has MSUD. But it doesn't tell you anything about what you're going to do with diet.
It was mentioned that maybe it was leucine that in the past was thought to be the primary, and now it's seen that it's not.
Okay, so are you talking about what the problems it causes? Yep.
Now they said that the focus was more maybe before on, now they realize.
Yep. Yep. So we say leucine, but we've also got what we call the leucine-associated acids. Yes. They believe that those acids that are produced from leucine are actually more toxic than the leucine itself. But both can produce toxicity, especially when you're sick. So it's actually both, and it sounded like this morning they decided that the acids that are associated with the leucine might actually be more toxic and contribute more to that cerebral edema than we initially thought. It's still leucine. Yep, yep. If you're taking too much leucine, you're going to be producing much of those acids.
Or it could be algae. It could be allergic something. I focus on several rash, I was allergic to medication, so it could be algae.
Oh, okay.
We'll look into that.
Okay.
Does algae factor in with some of the? You can't get rashes and you're allergic to medication if it happens to me.
Okay. All right, I'm going to move on.
Maybe it's like a protein substitute. I choose from this.
Okay, so let's talk about food. So typically, unless if the babies took a real hit when they were diagnosed, typically the MSUD patients are able to start solids at the same age as any other baby. So around 4 to 6 months. What do we want to count? We want to count leucine. You don't need, if you look at the tables or you go on the apps that are on the computer, it's going to list leucine, valine, and isoleucine. The only one that you need to count is leucine. Okay, so if you're counting all three, you don't need to. Save some time. And again, why is that? Again, food contains about 50% valine and isoleucine compared to leucine. So if you're counting leucine, there's no way you're getting too much valine and isoleucine. Okay? Okay, another thing that's really important to this diet is what we call low protein modified foods. Does everybody have availability of these foods? Okay. So what these are foods that are made primarily from wheat starch. So typically when we make bread, we're using flour, that's protein, and starch. What these products do, they take out the protein and they make them with wheat starch. And they've gotten very creative on lots of these products. Bread cereals, there's meat alternatives, low protein cheeses, egg substitutes, they're all out there now. I will put just a caution out, is that these tend to not be, if we're concerned about somebody's weight, these tend to not be low calories. They have the same calories as the regular foods do. So, and I know people like to eat these. They're low in leucine. You can have a whole bunch of it. But if you are somebody who's, we do need to be concerned about, putting on a little bit too much weight, this is an area that's pretty easy to go overboard with. So.
If it's high calorie, then it's high glycemic.
So here you're now getting into more the diabetes end of things. Again, I would say that for MSUD, we really don't need to be concerned about the glycemic index. which is what you're talking about, how a food increases blood glucose levels. These will tend to increase blood glucose levels faster. If we took a piece of low protein bread and we ate that and a piece of whole wheat bread, your blood glucose levels would probably spike more with that low protein bread than it would the whole wheat bread. But again, that's a whole nother topic, and in general, I'm not going to go there, but you are right. In general, these can increase blood glucoses a little bit more than quote unquote normal versions of these.
Can I ask, are these MSUD, are these specifically depleted in leucine, or is it just low protein?
Low protein. It's just low protein.
It's intact protein. It's just
Yep. So most of these things are like less than 1 gram of protein, so less than, that has some leucine, just a whole lot less than a regular slice of bread would. Okay. How are we doing with time here? Ooh, all right. Counting leucine. So there is a food list on the MSUD Family Support Group that you can use. I didn't have a photo of it, but there's also a little booklet that's put out by Emory University. It's called the MSUD Food List. Easy to carry around. If you're like everybody else now, you're carrying your phone around. I would suggest looking at, it's called FLOK, F-L-O-K. It used to be the National PKU News, but and it used to be only a site that had phenylalanine and protein for PKU. You can now go on FLOK and say what disease or what disorder you're talking about, so you would choose MSUD, and then the data that you get contains milligrams of leucine, it contains protein and energy. So they've expanded this website. You can also get it on your phone now.
I vouch for that.
Okay, good. So again, it's probably maybe a couple years ago it started, but anyway, you are able to. This is an online, on the phone app that you can use.
Oh, you could use cooklove.com for some recipes too.
Yes. The other nice thing about this is it does have the low protein products in there. It has the formulas in there. It has, lots of foods. So definitely check it out if you haven't yet. Another kind of trick that you can use is to estimate leucine from food labels. So it kind of depends on what type of food we're talking about, how much leucine there is per gram of protein. But an easy kind of number to keep in your head is mixed foods, or is 60 milligrams of leucine per gram of protein. So you can go and look at the labels and multiply, look at the protein content, the serving size, which would be up here, multiply it times 60, and that's a good estimate of how much leucine is in that food. So it's kind of a handy thing to have, just because there are so many foods out there and you can use the labels. Okay, so this is what concentrations we're looking at for blood levels. Okay, some of you probably have micromoles per liter from your lab. Some of you might get milligrams per deciliter from your lab. The numbers might vary a little bit depending on where you go. And so clinics might have somewhat different numbers, but these are the numbers from the papers that are out there. And let's just look at the leucine numbers here. So for infants, we're shooting for 100 to 200. We're trying to keep the leucine concentrations tighter. It's not always possible, especially if you have somebody with classical MSUD, but we're trying to keep it as tight as we can. For older kids, we go 100 to 300 for micromoles per liter. You'll notice that these numbers here, our goals, are actually somewhat higher than normal. The reason for that is that if you're too tight, you're being too restrictive with your leucine, you can actually have some issues with growth. So parents especially, and we learned over time, that we want the leucine a little bit above normal. Again, if we're running too low, it can affect growth in growing kids and infants especially. You'll also notice that the valine and the isoleucine are actually quite a bit higher than the normal range. And again, we're trying to shoot for a little higher isoleucine and valine. Again, we want to have isoleucine available so we can combine with the leucine, make protein so we can get that leucine level down. And we have found over time that if you run those levels a little bit higher, you're actually more successful in keeping those leucine levels a little bit low. So again, talk with your clinic and their goals, but they're probably going to be, again, a little higher than normal with leucine, and maybe up to 2 times normal for the valine and the isoleucine. Okay, any questions about that? How are we doing on time? Okay. All right, so let's say you sent your levels in and the leucine comes back high. Why is that? If you're not sick.
You cheated.
Yeah, okay, you cheated. The biggest reason is you're eating too much leucine. And it happens, especially if people, you just know that this looks like a half a cup of corn. Just making this up. If you're not really measuring it very often, that half a cup of corn kind of gets a little bit bigger and a little bit bigger on your plate. It's very easy to overdo the leucine. So that's the first thing you want to try is, okay, my levels have been running high. So let's be a little bit more proactive here, get out the scales and the cups and stuff and see if we're really getting to that leucine that we're shooting for, or are we actually getting a little bit higher. It's really easy to get a little bit higher. Another thing you can look at is are the valine and isoleucine lower than the leucine levels. So sometimes, if the leucine's running, let's say it's in the 400s, but your valine and isoleucine are actually down below that goal range, just increasing the amount of isoleucine and valine can drive that leucine level down. So sometimes that's something that we try in clinic, where we've got a kid, he's healthy, doing fine, but the leucine levels are running above what we're trying for. Let's look at the isoleucine and valine levels. Try a little bit more of those and see if that actually reduces the leucine levels. And it works a lot of times. Calories sufficient. If you're not taking in enough calories, your leucine level might be running a little bit high. And so that's also something to look at. Are you getting enough calories from formula? Do we need to increase the fat intake a little bit? Sometimes just looking at how many calories, bumping those up a bit, especially with somebody who's growing, really, really active. Just doing this can often get those leucine levels to go down a little bit. Other things, evaluate the formula. Are you getting too little protein from the formula? Sometimes increasing the amount of protein from the formula, again, especially if you're growing, really active, this might be a solution that can help reduce the leucine levels. This is kind of a big one, hidden illnesses or infections. So girls during their periods, oftentimes their leucine levels are higher. They might be needing a modified sick diet during that time to keep the leucine levels lower. Sinus infections, dental problems, kids who have, swollen gums or whatever. We've had patients come in, their leucine levels are up. They go to the dentist, they get things fixed, and the leucine levels come down. So these hidden infections, all those things really can bump up your leucine level and need to be explored if you're seeing high leucine levels that can't be explained any other way. Another one, urinary tract infections. Leucines are high. You might be feeling fine, but if you treat that, that can help the leucine level. Really, the last thing that we do is decrease the leucine prescription. Most of the time, some of these other things will work, and we don't really need to decrease the leucine prescription. It tends to be pretty steady throughout life. If you're going through the adolescent growth spurt, it might increase. Sometimes we see when they stop growing, the leucine needs tend to go down a little bit. So that late infancy, they're growing gangbusters during that first year, and then we're hitting 18 months or whatever, and the growth slows down a little bit. That might be a time when we change the leucine prescription. But in general, it tends to be pretty steady for a person. Okay, any questions at all about these? Okay, I'm going to talk a little bit about illness management. So any illness can cause leucine levels to increase. I'm sure you guys know that. But I also want to point out that injuries, broken bones, etc., that can make your leucine level shoot up too. Surgery, if you need to go in and get your wisdom teeth out, talk to your metabolic clinic, get some plans, because that surgery is going to increase the leucine levels. Pregnancy, after pregnancy, all of those times are times when the leucine level is going to increase or can increase. So again, what's toxic is the leucine and those acids that are produced. And I think you've heard enough today about what that can do. So everybody needs an emergency protocol that you carry with you. Most places do like a letter. People keep it in their pocket. Some clinics do like a little laminated card that they keep in their wallet. That works. Using the ER bracelets, ER necklaces, something that if something happened to you and medical personnel saw you, something that's going to say, hey, I have MSUD, call this number, or I'm followed at X hospital, something like that. They have some really funky looking ER bracelets now that are pretty colors and everything else. Whatever it is, but you need to have something that if something happened to you, or if you've got your child and they get sick or whatever, you need to have that so that if you go to an ER, they'll have some indication of what's going on. Okay, so I want to talk a little bit about sick diets. So does everybody in here with the person that you know have a sick diet? I'm hearing a whole bunch of yeses. Okay. Sick diets, what we're trying to do is keep calories up and give enough protein without the leucine so that we can try and slow down that breakdown process that happens with illness. So when you get sick, all that infection process that's happening, all of that starts to break down protein in your body, and that releases leucine. So we're trying to slow that down. So your team can really help you design a sick diet. Some clinics, especially if you've got an infant, they're not even going to say sick diet, they're just going to say come in. We're not going to have you do anything at home. For older patients or children, this is totally appropriate. But the thing I want to bring up is that sick diets don't work forever. If you're doing it more than 2 or 3 days, you probably need to go in and just get this taken care of and not go on and on and on with the sick diet. The other thing I want to emphasize is if you're putting yourself or your child on a sick diet, call the clinic. Let them know. Because we need to know that somebody's not feeling well if you call and we're not getting any better and we need to have you come in. So in general, what sick diets do is, and I can't emphasize this more, sick diets with MSUD need to have the formula, okay? With some of these disorders, we can get away with a lot of juice and a lot of sugar. That doesn't work in MSUD. It really needs to be the formula that you're emphasizing. So we want to continue the usual formula volume, increase if we can. And we're going to want to take out some of that leucine from the diet. Some clinics will go down and say remove leucine altogether. I think we're moving away from that because that can get dangerous pretty quickly. So we always tended to go more with taking out half of the leucine, or maybe a little bit less than that. We left some in there. But again, depends on your clinic, depends on how sick this person you are. But we will remove some leucine. We want to add valine and isoleucine to keep the intake of isoleucine and valine at least what you are taking when you're not ill. So if you're taking out food to decrease the leucine, you're also taking out isoleucine and valine. So you need to add that back in. And at a minimum, add it back in to the amount that you usually take when you're not sick. We tend to go a little bit higher than that. But those are things to consider. And then additional calories. Are you able to take more calories? But really, we need to keep that formula going. That's the most important thing here. So when do we use these? We tend to not use them with really young, like infants. We tend to say, if the baby's sick, we're just going to have you come in because we want to know what's going on. We want to know what the baby's leucine level is, and we'll take care of you in-house, probably. But older kids tend to do quite well with sick diets as long as they're not using them for too long. So you guys said you had a 2-year-old, was that right? Yeah. You probably haven't been introduced to sick diets yet. They probably want you to just come in, let's take care of it in here. And a little older, we'll figure this out for you. Yeah.
What does a 100% leucine-free diet look like?
So essentially, you're eating like fruits and low protein products. We had families, they would make what they called butter balls, where they took, you've had butter balls, okay. Take butter, put in sugar, put them in some powdered sugar, and that's lots of calories. It's really sweet and gooey, but from somebody who's had butter balls, maybe they don't taste so great. But it's kind of, again, we're talking foods that don't have leucine in it. Are we out of time? Yeah. Okay, you guys, I'm really sorry. But ketones, are you measuring ketones? Yes, okay, great. Okay. And pregnancy, I'm just going to say right off, pregnancy is possible in MSUD. The women themselves have to be monitored really closely. The most dangerous time is after delivery. That's when you really need to watch these women because they can get really sick. It doesn't seem to be that it affects the developing fetus if you've got good control during pregnancy. But that after pregnancy is critical. All that tissue is breaking down, dumping leucine into the bloodstream, and you really need to be careful with it. Okay, I gotta go because I'm gonna get in trouble. But